Welcome. My name is Tori. Today, you'll be tagging along for a 30-minute outpatient occupational therapy session. My team of OT students, Lisa, Taylor, Julia, and I, put this together and will help to explain some things along the way. Check out the link below for the client's medical history and detailed documents. If you're ready, follow me to the therapy room.
Hi, my name is Tim. I had rotary cuff surgery a week ago today, and now my doctor sent me here to see you. I've never heard of this type of therapy before, but if it gets me back to holding my little girls and working my job and farm, I'm up for it.
Okay.
Hi, Mr. Giles. How are you today?
I am good.
That's good. How have you been since your surgery?
Pretty good.
Pretty good. Any pain?
No.
No pain in your arm. Have you had any issues at your ranch getting around, sleeping?
No.
Okay. So before we get into our session, I want to go over some precautions that I would like for you to know and can remember by the end. Is that okay?
Yes.
Okay. So the first one I want you to understand is that we don't want your arm moving around any type of active motion. What that can do is irritate or aggravate your injury. The next thing I would like for you to know is that I would like for your sling to stay on, except when you are bathing or exercising. You also should not lift any objects over 5 pounds. Your shoulder should not be moved behind your back, because that also could aggravate your injury, and we don't want that any further. No excessive stretching or sudden movements. No supporting your body weight with your right arm. Okay, so we don't want to see you getting strong doing any push-ups right now. Okay, and always remember to keep your incision clean and dry. Have you had any obstacles in keeping your incision clean and dry?
No.
Okay, wonderful. So let's get started.
There's a couple other things to point out at this time. It's important to let our clients know that rest is so important for healing after a surgery. If you feel tired, you should definitely take it easy. Also, their arm will most likely be in a sling for 4 to 8 weeks. It's important to always use the sling when walking or standing. When sitting, it's okay to loosen the sling up, but they shouldn't remove it. We'd like to encourage them to try and walk and stay as active as possible. Also, another reminder, they may not have full use of their arm until up to 4 months post-surgery. Eating, writing, and drinking are actually okay things to do, as long as they're only moving the joints of the elbow and the wrist. One other thing to especially consider here are that digestion and bowel movements can actually be a little off post-surgery. This can be due to medications and just changes to the body. It's important to ask our client about their bathroom use and comfortability post-surgery. Another thing to remind them is the importance of icing their shoulder for about 10 to 20 minutes every 2 hours to reduce swelling and pain. Also, although we're starting rehab right now at 7 days post-surgery, in some cases, a rehab exercise program might not even start until 6 weeks post-surgery.
We successfully removed your sling. The first part of our session is to perform exercises that are meant to improve your motion, strength, and mobility. Are you ready?
Yes.
Passive pendulum swings will be the next exercise. First, this exercise will be modeled by the therapist, and then skilled instruction will be provided to the client.
Put your left side on top of the bench, your left hand on there. We want our right arm to comfortably relax, and we're going to rotate our cuff 10 times clockwise and 10 times counterclockwise. So clockwise, 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, and then counterclockwise, 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. Keep that for next
The next exercise includes passive range of motion, external and internal rotation. Keep in mind that our goal is to reach 35 degrees of external rotation by 8 weeks. Normal range of motion for external rotation is 90 degrees. It's important to support the elbow and forearm completely during these exercises while the client is seated. We'll do internal rotation 5 times and external 5 times. Next up is a passive range of motion wrist stretch. This one can be performed by the client or by the therapist. Today, the therapist will be performing it. It's important to consider safety and post-surgery precautions when doing this stretch. The next set of exercises are active range of motion tendon glides. These exercises increase circulation to the hand and the wrist and reduce swelling. They also help to increase healthy soft tissue around the area of the surgery. We're going to run through these motions 3 times. Next up, there are 3 resistance exercises used to maintain strength and endurance while preventing deconditioning of the affected upper extremity. We'll start off with wrist extension and flexion using a can. This is due to weight limitations from the rotator cuff surgery. It's important to consider the positioning of the client during these exercises, as well as all the exercises we've done today. In this situation, we'd want to make sure he's comfortable and that his shoulder isn't flexed too much up on that table. Resistance exercise number 2 is bicep curls. Once again, we'll be considering the client's positioning, comfort levels, and keeping weight precautions in mind. They will complete 3 sets of 10. It should be noted that no parts of this intervention are meant to cause the client any pain. Next up, the client will work on maintaining their grip strength by using a stress ball and squeezing it. They'll do 10 reps and 3 sets.
The next part of our session, we're going to practice upper body dressing. Part of the precautions that we went over earlier were that you cannot bear any weight on through your right arm, and that there are no sudden movements. When you are practicing upper body dressing, you should be sitting in a nice, comfortable position with your arm down and a pendulum motion, okay? So when we are doing upper body dressing, one, we want to make sure that our shirt is facing the correct way with the back of the shirt facing up and the front of your shirt at the bottom. You're going to put your right arm in first with the assistance of your left arm. You're going to put your right arm through the sleeve. Using your left arm, you're going to pull the rest of the shirt up over your head and then put your left arm through the left sleeve hole. Okay, would you like to practice that?
Yeah.
All right. Let's see. I'll put the shirt in the correct position for you. You'll use your left arm. Good job. Right arm through the sleeve assistance. Yep. Left arm pull all the way up. Okay, and adjust as needed. All right, good job. So the next part, we're going to take the shirt off. And to do that, we kind of just go in reverse order. So you, want to actually take the back of the shirt from over your head, take your left arm out, and then use your left arm to assist you taking the shirt down from your arm, because we still do not want that arm to move. Do you think you could try that?
Yeah.
Okay.
I got skill.
Good job. And that is upper body dressing.
We will also practice lower extremity dressing in this intervention. The client might struggle with certain things such as buttons, especially since his dominant hand is the one that's affected. If this is the case, we will implement some recommendations and try to help him to make the task a little bit easier. We'll end this session with a wrap-up. This will include client education and some reminders that we touched on earlier, such as icing the affected shoulder and potential GI issues. And then we'll ask some clarifying questions to see how much they comprehended and how much they gained from the session.
Today we went over precautions. We practiced exercises that'll help improve your motion, your strength, and your mobility in your right arm. And we also went over upper body dressing. Do you remember any of the precautions that we went over?
Yeah, I do. I remember one thing that you said was to remove the sling while exercising and bathing. Another thing was to make sure not to lift anything over 5 pounds. Also, to make sure there are no sudden movements so I don't further injure myself.
Okay, and another one is to make sure that you keep your incision clean and dry. Do you have someone to help you with that?
Yes.
Okay, wonderful. Are you in any pain right now?
No.
Okay. So one of the things, if you do experience pain after a session, you can manage it with ice. Recommend that you put an ice pack on your shoulder for about 10 to 15 minutes. I have some information that I want you to take home with you. There's some further directions on how to manage your pain with ice. It's also some additional information on your precautions and a home exercise program that you can use to help improve your motion, your strength, and your mobility in your right arm. Do you have any further questions?
No.
Okay, wonderful. Thank you, and enjoy the rest of your day.